you want to try quit smoking, it's really bad for your health, you know. You might eventually get sick later.
It's nothing. I have been smoking this for years. I think there's nothing to be worried about.
To you then, I'm just reminding.
Anyway, let's go to my house for a bit. My father asked me to deliver some stuff to you.
Oh, let's go then.
Let's go. Stop here. Assalamualaikum.
Waalaikumsalam.
Abba, what are you doing?
Oh, I'm just doing some works.
Uncle, are you okay?
Oh, I'm just fine. Oh, alright. I want to give you some stuff, right? Wait a minute.
Yunus, are you sure your dad is okay? His cough seems like it's getting worse.
Oh, she's fine actually. It happens all the time. Hey, what's wrong?
Doctor, he's there. Thank you.
So doctor, how's my dad's condition?
Before I tell you about his condition, may I ask you whether your dad is a smoker?
Yes, my dad.
Okay, so we have run some tests on him and we have been diagnosed that he's a COPD patient.
COPD? What is that? So, do you guys know about COPD? COPD, or chronic obstructive pulmonary disease, is a common lung disease causing restricted airflow and breathing problems. Emphysema and chronic bronchitis is the two most common conditions that contribute to COPD. Chronic bronchitis is inflammation of the lining of the bronchial tubes in which carry the air to and from the alveoli. For emphysema, it is the condition in which the alveoli at the end of the bronchioles are destroyed as a result of damaging exposure to cigarette smoke and other irritating gases. Although COPD is a progressive disease that gets worse over time, COPD is treatable. With proper management, people with COPD can achieve good symptom control and quality of life, as well as reduce risk of other associated conditions.
I will talk about causes of chronic obstructive pulmonary disease or COPD. Firstly, it's important to highlight that carrier exposure, whether through active smoking or passive exposure to secondhand smoker, is a major risk factor for COPD. Smoking damages the lungs over time, leading to inflammation and narrowing of the airways, which are characteristic features of COPD. Additionally, occupational exposure to dust, fumes, or chemicals can significantly increase the risk of developing COPD. People working in industries such as mining, construction, or agriculture may be exposed to these harmful substances, which can cause chronic lung damage and respiratory problems. Indoor air pollution, whether from biomass fuel like wood or coal used for cooking, can contribute to the progression of COPD. Prolonged exposure to these pollutants can damage the airways and lungs, exacerbating COPD symptoms. Lastly, a rare genetic condition called alpha-1 antitrypsin deficiency can lead to COPD at a young age. This genetic disorder affects the production of a protein that protects the lung from damage, making individuals more susceptible to developing COPD, particularly if they smoke.
Okay, now let's move on to the symptoms of COPD. There are several symptoms of COPD, which are shortness of breath, especially during physical activity, chest tightness, chronic cough that is often comes with production of mucus, swelling in ankle, feet and nails, fetish, and last but not least is wheezing, which is a whistling sound your breath will make when your airway is partially blocked. However, it is important to note that these symptoms may vary in severity and can worsen over time. If you ever suspected yourself having COPD or experiencing any of these symptoms, it is important to seek for professional health care for proper diagnosis and management. Now, I'm going to talk about the treatment for this COPD. Unfortunately, there's no cure for this chronic obstructive pulmonary disease COPD yet. However,
There are several treatments that can help to slow the progression of the condition and control the symptoms. First of all, it is important for a smoker to quit smoking. This is because smoking is one of the main causes that leads to COPD. Although the lungs that are damaged can't be cured completely, giving up on smoking may help the lungs from further damage. Quitting smoking not only brings benefits to the smoker, it is also beneficial towards the second-hand smokers as they also have high risk of exposure to COPD when they inhale the smokes from the cigarettes. Next is the usage of inhaler. Most patients with COPD will be given an inhaler as a medium to deliver medicine directly to the lungs as we breathe in. The inhaler used is the similar one to the one that is used by asthma patient. This inhaler helps COPD patient to relax the muscle around their airways, thus helping them to relieve coughing and shortness of breath. There are several types of inhaler which are short-acting bronchodilator inhaler, long-acting bronchodilator inhaler, and steroid inhaler. Furthermore, there are also medicine that will be prescribed by the doctors to help in reduce the symptoms of COPD. However, this medicine is usually prescribed to someone had highly severe symptoms only as the medicine has side effects towards the consumers. To ensure the daily activity of COPD patient is not interrupted, there are also pulmonary rehabilitation provided. This program of exercise and education designed to help people with COPD. This helps to improve on how much the patients can do physical activities before they're running out of breath. Examples of the program includes physical exercise training, education on COPD's condition to the patients as well as their family members, dietary advice and psychological and emotional supports. Lastly, there are also surgery that will be considered to the patient that cannot control their symptoms with medicine and inhaler.
Alright, let's wrap up our discussion on COPD with a look at some recent data specific to Malaysia. First off, a 2019 study revealed that the 30-day readmission rate for COPD exacerbation at a Malaysian tertiary hospital mirrors seen in high-income countries. This finding shed light on the significant impact COPD has on healthcare system across different socio-economic settings. Now, let's dive into the numbers. Back in 2010, the prevalence of moderate to severe COPD in Malaysia was recorded at 4.7%, which translates to a staggering 448,000 cases. It's worth noting that the majority of these cases were male with an average age of approximately 72 years and a median smoking history of 45 years. These figures underscore the demographic and lifestyle factors contributing to the burden of COPD in our country. But it's not just about the numbers. COPD takes a toll beyond the individual level. It's associated with reduced workplace efficiency, activity impairment, and caregiver burden. A recent study highlighted that over 30% of COPD patients reported productivity loss, while nearly 20% faced limitation in daily activities. This finding underscores the broader societal implication of COPD beyond just healthcare. In conclusion, the recent data on COPD in Malaysia paints a sobering picture. From high readmission rates to significant prevalence figures and the socio-economic burdens it imposes, COPD demands our attention and concerted efforts for prevention and management. It's crucial that we continue to raise awareness, advocate for healthier lifestyle, and invest in healthcare resources to address this pressing public health issue.
Oh, so how's your dad's condition?
Just now the doctor said that he is a COPD patient.
Oh, I've ever heard of that disease. No wonder his cough is really worse.
Yeah, doctor said that his condition is getting worse because he is a smoker. I think for the sake of my health, I should quit smoking too.
Yeah, as you should.